What are the main findings of the study?
This is a really interesting study. It's actually two studies combined in one. And the first study was to assess the need for new therapies in rhinitis. And what was done was a survey with the English database of patients who had diagnosis of allergic rhinitis, seasonal allergic rhinitis, and to see what medications they were taking and to see how well they were doing. And the vast majority of these patients were taking 2 or more medications, and yet, in spite of the fact that they were taking 2 or more medications, they had symptom scores which were quite high. For nasal symptom, total nasal symptom scores, 12 or above. For total ocular symptom scores, around 8 or above. These symptom scores indicate moderately severe allergic rhinitis in spite of the fact that they were taking multiple therapies. These type of symptom scores would qualify them for studies looking at moderately severe allergic rhinitis. And so the second study took that information and saw how 2 of the types of medications they were taking compared with a combination of fluticasone and azolastine in the same bottle. And what we can see here are symptom scores comparing this drug, MP2902, the combination drug, with azolastine alone, or fluticasone alone. And one can see that this combination was highly more effective, and also in the time course, that at every time course measured, it was highly more effective, and it was more effective in all the nasal symptoms. So the take-home message is that there's an unmet need, and that this unmet need can be addressed by MP2902, a combination of fluticasone and azolastine in a single bottle.
How will this study affect patients in the future?
Well, I think it's very important that we take this information and apply it clinically. Based on personal experience and also many other studies in the literature, this is the best treatment, the most efficacious treatment for seasonal allergic rhinitis that we have at this time in our therapeutic armamentarium.
Where do you think this type of research is heading in the future?
Well, I have a personal bias. I think that we have established that this drug is highly effective in allergic rhinitis, but I think that the drug has much more to offer. And one of the most difficult problems that we deal with is chronic non-allergic rhinitis, or patients with mixed disease. And I believe that this drug has a great potential to help patients with non-allergic rhinitis as well. And I think we need to explore that issue.
Thank you.
Sure.